Okay. What is this? I don't want that. Look at that. Massage techniques. I think I'm going to change things up a little bit, but I'll tell you after. All right. I'm always changing things up. Deep tissue techniques for the upper extremities. Now, I know that last week we did stuff already to address like the stripping in the arm, epicondylitis, carpal tunnel, trigger finger, stuff like that. So you guys already know how to give an arm massage. So what is deep tissue massage? So now we're going to start trying to do more deep tissue stuff, okay? So deep tissue targets deeper layers of muscles, your fascia, your connective tissue, and tendons. Usually it's slower, it's a more sustained pressure, and this helps to release knots and adhesions. An adhesion could be in the form of a knot, or it can be in the form of just a long band, okay? Goals of deep tissue is to reduce chronic tension, restore mobility, and alleviate pain. So a little more than just your bougie relaxation Swedish massage. So this is just a recap of some shoulder muscles. Obviously the deltoids, we're talking about anterior, middle, and posterior fibers. Your 4 rotator cuff muscles, your trapezius, and your rhomboids. So those are some of your shoulder muscles. Then the arm muscles you guys should kind of know by now is your biceps, your brachialis, and your brachioradialis. Then we got your triceps, then your flexors and your extensors of your forearm. So you should kind of have an idea of where these are at on the body, all right? If you don't know where your biceps are, you need to go home. All right, so deep tissue techniques. I'm going to jump to the bottom real quick. That's all yellow. Authentic deep tissue does not mean we are using all the pressure and weight that we can summon. That's not what this is about. It should not cause injury. All right, deep tissue doesn't mean the hardest that you can go, is what I'm trying to say. But clients think that that's what that means. So we need to start re-educating our clients. And my booking software is kind of based on what clients think. So I have my relaxation massage in a category, my therapeutic in a category, and then I have my deep tissue that is $10 more because they think that I'm exerting myself, which I am, more. All right, but it is technically a therapeutic, just with more intention.
Slightly off track. I don't know if you want to answer it later. So as far as charging per modality or type of massage.
Yeah.
So I've been reading the arguments of I'm there for the time, I charge the same for no matter whatever I do, and then other like this requires more energy, it requires more knowledge, it requires more continuing ed. Like what is your argument on that? Like,
you can do what you want.
Well,
like I do it based on modality. Like,
do people feel like they're getting more for their money then? If
I
feel
think
like
so.
You're giving them a name,
yes.
Rather than I'll just treat you for whatever I feel you need.
Well, and some people, which I thought about doing it, but my staff has advised me against it. Some people just do a custom massage. They do.
Yeah.
It is the price, and then you can either have whatever therapies you need or modalities in that custom massage, or you can have add-ons and charge. Like I charge for cupping and hot stones and aromatherapy. Anything that's beyond the regular massage, I have as an add-on to enhance your experience. You don't have to do that. You can have it all included, but also be mindful of what the energy you're putting into it again also, and you want to charge based on your worth. I don't recommend going out of here and making your prices $1 a minute. A lot of people do that, 60-minute massage, $60. That is way lower than the national standard. Don't do it. because then you're going to start noticing that you are raising your prices often because you're not making enough money to pay your bills. You don't get that whole, say it's $60 for that hour, you don't get that whole money, all that money, even if you're your own boss.
25% to tax.
I do that, actually. I do more, okay? Not that you guys care, but I pay myself $65, and the rest goes back to the business. For taxes, utilities, overhead. I do have staff, and their percentage goes to all that too, but I wouldn't feel comfortable taking 100%. But that is up to you, whatever you charge, but I don't recommend doing $60 for an hour. That's my advice. You don't have to take it, because I have clients from years ago, last year and the year before, that charge that. And yes, we're in a rural area, so that also means don't charge like $150 for an hour massage. You have to kind of find a good balance. My advice is to look around, check out other people's prices, and kind of be around that range within like $10 to $20. All right. I've actually encouraged a lot of local therapists to raise their prices because the prices are too low. So yes, that might mean that we're losing business to the lower price places, but I also think it shows our worth. So you can customize your schedule and your pricing to whatever you feel comfortable. There is no right or wrong. You can charge extra for add-ons or not. You can charge based on time only or modality. So if you want a short, easy schedule, just do therapeutic massage. Done. Or custom massage, right? All right, where am I at? So deep tissue techniques typically they start broad. It's a firm effleurage. You start broad and firm to warm up the tissue. You're not going straight in with an elbow. And you guys are going to start seeing this with clients as we start working on them. When you're trying to put the lotion on and they're all like, you can go deeper. Thank you, Captain Obvious. But I'm just applying lotion and palpating. So you can also tell them that. So stripping, this is the deep, slow muscle stripping along your fibers. If you're not doing that and you're going against the fibers, that is now the cross fiber friction. So these are what we're using to break up adhesions and knots, tense, taut bands. Then we have something called trigger point release. We have an entire semester on it, but we're going to learn a little bit. It's a sustained compression on a specific trigger or a knot or a spot that's tender. Right. And typically, I know there's a slide here, but trigger points typically will have a referred pain pattern, which I'll go over. So therapist body mechanics are super important when applying deep tissue techniques because you are sustaining that pressure a little bit longer. So we're not just using our thumbs and our fingers. We're using forearms, your knuckles, soft fists, hard fists, elbows, feet. We aren't, but if you do ashiatsu and learn that modality, you are using your feet, and that's cool. As long as they're clean and the toenails are nice and they're not like stabbing your client. Here's some deep tissue massage and a cut, a laceration. So with deep tissue, you want to gradually apply the pressure. Like I said, don't go in as hard as you can go. All right, gradually. You'll start noticing that you can go a little bit deeper into that tissue the more you work on it and it warms up. Kind of like putty, like sticky, what's it called? You know what I'm talking about. The older people in the room. Silly putty. Silly putty is almost like kind of stiff, and as you warm it up, it gets more elastic. We're going to be working with our leverage and our body weight. So as you're trying to do different, deeper techniques, I want you to keep straight arms, straight wrists, whatever, and then lean into it. So try to start using your body weight and not just standing there and using your shoulders. So You can adjust your body weight, especially if you're in the horse or the archer stance, because you can kind of pull out of it or go into that area a little deeper to adjust it based on your client's needs. When you're doing deep work, maintain good communication with your client and look for nonverbal cues. They might kind of pull away from you, lighten up the pressure. They might pull away from you and you say, is that too much? And they go, no, just keep doing it. Don't listen to them. Like, if your body is tensing up, it's not in a relaxed state where it's going to receive the massage well. So if I notice that the nonverbal cues, I instantly, most of the time, will lighten up just a little bit. And then, you can ask how the pressure is. Here's a picture of a trigger point. A trigger point is a hyper-irritable spot in a taut muscle band. It refers pain locally or to a distant area, which means, referred pain means, think of a headache. This is a good example. Your neck is so tight it's causing you a headache and you feel it here. Doesn't mean that this is the cause of the headache up here. The pain is coming from a different area. So that's called referred pain, right? I might have a trigger point in my forearm, which is giving me an ache in my hand. So that is what your referred pain, what we're talking about with that.
This feels like a stupid question, but.
There are no stupid questions. Yes, there are. Yeah, let's hear it.
Is that like when you find a knot? Is it just a sore spot? What are we as a
Okay, so the knots that you're feeling, those are adhesions. So as we learned about the trigger points, there's going to be active trigger points. There's going to be inactive. There's going to be things called satellite trigger points. There's a lot of different types of trigger points. If you push that knot and it doesn't refer pain, it's not active.
Okay.
All right, but
Carly's got golf balls.
My
left
left
forearm
forearm
yesterday it was causing she was just trying to do that system.
Yeah.
And I'm like, it's too much, it's too much.
yeah,
Would that be considered more, since it's causing
pain.
a whole reaction?
It could, yeah, that could probably be more of an active trigger point and it's causing an issue somewhere else. Now, if I just push it and it's tender in that area, it tends to be not really active, but it is an adhesion. All right, so yeah, it's kind of the same thing, just not causing referred pain. Does that make sense? Sort of? Sort of.
I'm sure it'll come with practice.
It will come with practice. And you can, when you feel a knot, you can ask them, is that tender or are you feeling that run down your arm or in another area, and kind of judge that. Sometimes you'll push in there getting burning or numbness or something, because at that point it's irritating a nerve. So common areas for trigger points. Your traps, number one, most common. Your deltoid can have trigger points. Biceps, I don't ever feel trigger points in the biceps, but whatever. Forearm is a big area that you can feel the trigger points. So I would say the most common trigger points are between the shoulders and the traps and in your forearm. All right, that's typically where you feel those. Here's a picture of muscle fibers close up. And see these nodules here? These are the trigger points, all right? So a lot of times when you have a trigger point, it can cause something called a satellite trigger point and cause more, right? Because there's dysfunction in that muscle. So a lot of times it's not just one little guy hanging out saying, I'm going to cause you pain here. It's multiple guys hanging out going, we're going to cause you some pain here and here. Sorry. All right, so some of the common trigger points and the pain pattern would be, bless you, that was a crazy sounding sneeze. All right, upper trapezius. Upper traps can cause headache and neck pain. Your infraspinatus, so your rotator cuff muscle, right? Can cause a deep shoulder pain or an arm ache. Remember, your rotator cuff can cause referred pain in the deltoid. So there's that. Your biceps brachii. A lot of times it'll give you anterior shoulder pain or sometimes elbow pain because it crosses the elbow joint. And then your extensor carpi radialis, so you have flexors, extensors, will cause lateral epicondylitis a lot of times, all right? So it's running in through here. So some techniques, and we'll kind of go over some trigger point techniques. So you want to palpate, find that knot, that band. Like I said, it's not always a knot. Sometimes, a lot of times in the neck, you'll feel like it's almost like a thick rubber. It almost feels like a rubber band or just like a thick, long muscle. That is also a taut band or it could be a trigger point or have trigger points in them. So you're going to apply ischemic compression. So what that means is you're going to find that knot, apply pressure to it. All right, this says 10 to 60 seconds. A lot of the times it's like 10 to 15 seconds is most common for trigger points. Some books will say 20 seconds. There's a wide range of how long you should hold a trigger point. A lot of times I will hold that trigger point and then you can do something called like a stretch and hold. So you'd hold it and then stretch that muscle, maybe in the forearm. Say it's in my extensors. And remember, when you stretch your extensors, it's the opposite motion. So say I find one here and I flex so that it stretches. So that's what you're doing is either you doing the range of motion or the action or your client's doing it for you while you hold a tight spot. Let's see. So you will release it gradually, and you also kind of dig in a little gradually. You're not just going like this. You're finding that muscle, finding a spot that's comfortable for the client and holding it. All right, it could also be combined with breathing. Sometimes trigger points, like I'll do one with my elbow in the upper back and have them breathe. So if you find one, you can use your elbow gently at first. Take a deep breath in, and then on the exhale, release, and I tend to dig in a little bit, okay? And then when they're done exhaling, I will lift up just a little bit and then have them breathe again and then dig into it again. So you're not going to want to stay on an area for too long, maybe 3 holds and then move on to a new area, because if you work on an area too long, it starts getting hypersensitive and you can start feeling irritated because that area has been worked on too long. So you can also say something like, this area needs more work, but I'm going to give it a break right now and revisit it later. All right. So what are range of motion releases? So this is for mobilization. This is when we're adding pressure and having the client either actively move or we passively move them. So either they're laying there and we're doing a movement or they're helping us. This can help restore joint function and flexibility, and it can decrease the muscular restrictions happening. See how a lot of this is kind of review, other than the trigger point thing. Shoulder range of motion releases. So, say we're doing some rotator cuff releases passively. So you would grab their arm, as long as they don't have a lot of issues and they can move it, and abduct and adduct it. All right. You can do that while they're prone. You can do that while they're supine. You can hold certain muscles. Sometimes I'll actually have my whole forearm in and do range of motion with that arm. So I'm adding compression to an area, pinning it, and then doing a range of motion with it. Pin and stretch for pec minor and subscapularis. So a pin and stretch, again, you would be holding an area and then stretching it. Now, the pec tends to bring the shoulder back to the body, right? So a stretch would bring it away. You'll notice when I do pec massage, I tend to open up the chest so that I can work on these muscle fibers when they're in a stretch position. If you have a client that's really, really bad off, you can also work on those muscles and see how it kind of shortens in a shortened position. So you can bring it into its action. If you do that, you can have the client just kind of rest their hand here on their other shoulder and kind of work into the pecs. It is harder for women because when you do that, the breast tissue also kind of fluffs up with the muscle, right? Glenohumeral traction. So pulling on the arm and doing traction on this glenohumeral joint can also help free up shoulder range of motion issues. You can even compress. You can grab with one arm and kind of hold that shoulder down, okay? So just practice and play with your client's arms today. Elbow and forearm range of motion releases. So I was showing you guys a lot of this last week where I would strip the forearm and then kind of find a spot and do supination, pronation. This is this is exactly what I was talking about. You can even do some flexion extension. And with the triceps prone, you can flex and extend while you're working on that. And I'll kind of go back over that with you guys today to kind of reiterate that. So also we're going to talk about compression with the wrist. You can compress and flex and extend the wrist to kind of change the shape of the muscle when you're manipulating it, which we did all this in review with hands-on stuff. But hand and finger, again, we're doing the same thing. Massaging, warming it up, and then doing range of motion with the hands or fingers. This is why I tell you guys to extend and flex each finger. I like to go opposite like that when I do it. I also like to spread them apart so we're abducting each one. That feels really good because we use our hands for like everything. You can even do opposition and add a little extra to it, all right? You can have them do opposition with any of the fingers and then maybe even flex, extend, supinate, pronate while their hand is in a different position. You can give them homework like that. Yeah, some of you missed Hope's lovely demonstration on stretching the shoulders, arms, elbows, forearms, wrists, hands, all that. Metacarpal spreading and gentle compression. So, all feels nice. Make sure you do range of motion on those hands, especially if they have problems with their hands. I do the range of motion on everybody, the flexion, extension, abduction, because I think it feels really nice. And then everyone's like, oh, I can't believe a hand massage feels so good. In that exact voice. Hand massages are good. And hand massages are really good for hospice patients who can't receive normal massage, and it gives them that comforting touch. Hands and feet. All right, conditions benefiting from deep tissue and range of motion would be shoulder impingements, any kind of rotator cuff dysfunction, golfer and tennis elbow, carpal tunnel, repetitive strain injuries, blah, 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 blah. Right? You guys know this now because you're pros. Precautions and contraindications. Avoid deep pressure on acute inflammation or avoid deep pressure if there's a bruise there. You also want to avoid so much deep tissue that you're bruising them. Now, if they are on a blood thinner, they will bruise easier. But this is why we need to know if they are or not. Some people are like, yeah, I'm on it, but I don't care. Whatever. Can I get that in writing? Caution with nerve entrapments. Certain movements might pinch that nerve. So that's why the range of motion techniques are best when communicating with your client. So make sure you just communicate if they're having issues already. Also, deep tissue massage can cause nerve damage too if you're doing it incorrectly or too deep, right? So careful with that too, because then it's going to take your client longer to heal after the massage because now they're healing from an injury from the massage. That's why it's also important not to go the deepest that you can go. Modify the pressure for elderly or fragile clients. A lot of the fragile clients, you're not doing deep tissue too. And if you are, it's not super deep, right? Does that make sense? I'm saying it doesn't mean the deepest you can go, but it is getting in those layers. So they might not be able to handle that, or maybe you can just do a couple trigger point releases, and then the rest is the more relaxing techniques. Which happens with clients. Sometimes they're like, I just want to relax, but this hurts. Okay, so you're no longer in relaxation. We're at therapeutic. But I will say, can I do a little more when I find a knot, but then keep you kind of at a medium pressure? And they're like, yes. I'll let you know if it's too much. So that's a custom type thing going on there, which all massages should be custom anyhow. Also, warm up the tissue first. Make sure you do a lot of effleurage and kneading before you go to the deeper layers. Remember, the muscles aren't just all aligned. There's different layers of muscles. Key takeaways. Deep tissue equals slow, focused pressure. Typically, we're also going from insertion to origin, or origin to insertion, or whatever, okay? So that's why it is important to kind of know the muscles and the shapes of them and kind of around where they insert, because if you do massage on the full length of the muscle, the chances of kind of helping that dysfunction are higher. So not just doing one little muscle, you're going to do the whole length if you can. Remember, when you're coming up to the bony landmarks or the attachment points, lighten up a little bit because it's tendinous and it tends to hurt. All right, trigger point therapy reduces pain. I don't know why it says referrals. Whatevs. Range of motion releases, helps restore mobility. I did all kinds of typos here. And helps the length of the muscle get back to where it's supposed to be, instead of it all being discombobulated and the fibers going all different ways, and you want to kind of get it in a healthy state so that it functions properly. Combined techniques can be used to treat upper extremity dysfunctions. So as we learn more techniques and more modalities, you can throw whatever you know at that client that you think will help. Practice and demo. So again, we're just going to practice when we do the massage today and kind of try to feel for knots, try to introduce some deeper techniques with your client, whether they like it or not. No, I'm just kidding. Just keep checking in to see if the pressure is okay, because some don't like deep pressure. But I notice if you use a broader stroke, not just like tiny little fingers, the broader stroke doesn't feel as invasive. So try to find some trigger points today or knots. Figure out if they're referred pain or not, or if it's maybe inactive, which means they're not causing pain, down to a different area. If you do find one, try to do a pin and stretch. So especially with forearm muscles, you can try to find that muscle and then, do your range of motion and see if that knot reduces or less pain is caused. The idea is to deactivate the trigger points. Knots don't just go away sometimes. I have people with the knots in their traps, I call them say that it's part of them. And our job is to reduce the dysfunction and reduce the pain. They're not just melting away at your fingertips. I know that a lot of people say, I can feel the muscle melt away. No, you can't. You can feel the muscle warming up and the fibers redistributing, but the knot is not just going to melt away like a puddle. Okay, that's not really real. All right, we're just kind of reducing that. We can break away the knot a little bit and kind of get it smaller and smaller, but one session is not going to just make it melt. Okay, so that is false. I'm going to have so many people commenting, so mad at me. Shoulder range of motion and therapist resistance. So this is when I want you guys practice those shoulder range of motions if you haven't. If you have, keep doing it. And partner up, hands-on practice. We're going to do that anyhow. All right, any questions before I clear this out? Nah? Cool.